A new and more contagious strain of COVID-19 has spread to more than a dozen countries, and many health experts believe it is already here in the States. Meanwhile, European countries started their vaccine rollout over the weekend. The U.S. has reached more than 19.1 million coronavirus cases since the pandemic began. More than 333,000 people have died. Medical experts believe a larger surge is coming after millions of Americans traveled for Christmas and millions more will travel to ring in 2021. Hospitals are already past their limits, caring for more than 118,000 COVID-19 patients across the nation. For more on the state of the pandemic, I want to bring in Dr. Nissola. He is an immunotherapy scientist and an advisor for COVID Act Now. Thank you for joining us. Did I pronounce your name correctly?
You did. Thank
Great.
you for having me.
You bet. So, Doctor, even though we were warned to stay home, many people traveled or congregated during the holidays. We know there will be a surge, but just how dire do you think it will be?
Well, understandably, almost a year after staying away from family and loved ones, some Americans have held small family gatherings for the holiday season. So instead of publicly shaming them for doing that, I encourage people at home to get tested before and after flying. And if they did encounter people from other parts of the state or that are not part of their household, to quarantine before and after traveling to decrease the chance of spreading this new strain of COVID that is very likely in the U.S. already.
Dr. Nissola, as we mentioned, the new coronavirus strain first detected in the U.K. has spread to other countries, and many experts are saying it most likely is already here in the U.S. How might this new variant hinder progress that's expected to be made as more vaccines are distributed over the next few months?
Well, it's important to remember that we're dealing with a very complex problem here. First, RNA viruses tend to mutate, but so far, vaccine makers are confident that their vaccine, meaning Pfizer's, Moderna's, and AstraZeneca's vaccine, will likely be effective against this new strain of COVID. So I'm not that worried in terms of the vaccine efficacy and safety around the strain. What I am worried is that this new strain is more infectious. And what that means is that we are already seeing a huge surge of new cases because of indoor gatherings. And the weeks ahead will require us to be even more cautious about meeting people from outside our household because the virus is out there. And with this new strain, we'll very likely reach more people than before.
And Doctor, the vaccination distribution has, as we all know, been slower than anticipated. Why has this been the case? And do you think this will mean longer timelines for people who are not frontline workers to get it?
You're right. You see, we've promised to deliver these vaccines in this year for 20 million Americans, and we're very short from that. I do think that without a robust vaccination program that includes a digital platform for the vaccination control, we're not going to be able to vaccinate 330 million Americans that quickly. So I would hope to see that the new administration that's going to be walking in January 21st, that will provide us with some more guidance as to when, the average American will be able to get these vaccines, and perhaps a digital platform that will allow you to choose your appointment date, even if that's months ahead, will give you some sort of understanding and certainty that that vaccine will reach you. Now, we are aiming to vaccinate healthcare workers and prioritizing folks that live in nursery homes and the elderly, but we should also be considering vaccinating those teachers, those 3.7 million teachers in the United States that are ready to go to work, but they need to do so safely so we can reopen the schools as soon as possible in the U.S. in the next year.
Doctor, the AstraZeneca vaccine could be approved in the UK this week. What's different about that vaccine, and are you confident in its safety and efficacy?
So the truth is, we don't know. We saw a statement from AstraZeneca CEO saying that he was very confident that this new vaccine would be approved soon in the UK, and that would very likely be effective against this new strain. But we have yet to see the peer review data. Me, personally, I would wait to see the raw clinical data from AstraZeneca in order for me to make a better judgment call. they did have some issues with their clinical studies during this year. So I will be more confident after I review those papers, and they have yet to be published.
Dr. Leo Nissola, thank you, and thank you to you and all of your healthcare hero colleagues for everything that you're doing.
Thank you for having me. Happy
You bet.
holidays.
You too.